Hey guys, just want to make a video giving everyone an update as to my FUE hair transplant procedure done by Dr. Luis Nader. It is September 26th. I had my surgery on August 31st, so it's been about 3.5 weeks. And I just want to show everyone kind of what it looks like. It's kind of hard to see here, but I think most of my scabs are kind of gone. And let's see if I can show what the back of the head looks like. I'm not sure if you can see very well, but basically, yeah, it's been a few weeks. I would say the first week is kind of painful. I'm not gonna lie, it's hard to sleep, difficult to deal with the I would say there's definitely pain you have to deal with on your scalp, and if you don't take the pain meds as instructed by the doctor, you're going to be in pain. You're going to have a hard time sleeping, and it gets very annoying dealing with the pain. So yeah, if I could do things differently, I would have taken the pain meds versus trying to rough it. So because I basically didn't follow the procedure for taking the pain meds. I just took the antibiotics as prescribed and the anti-inflammatory. However, yeah, my head never swelled up or anything. I never had any, swelling at all. I think the anti-inflammatory helped with that. And also just the procedure itself done by Dr. Nader was minimally invasive, I feel. So that probably helped a lot in terms of like not having my head blow up like a balloon like a lot of people have after these hair surgeries. So but yeah, definitely uncomfortable. You're very tempted to like scratch and itch these areas. I did make a bunch of other videos about how to do the shower procedure. You basically just take the shampoo that he gives you and just kind of very lightly rub with your fingers the surgical areas to remove the scabs. I'm not sure if I even got them all. I think I have a little bit back here. I don't want to like pick at it, but eventually it'll just come off. It's not like this big blotch of scabs that are like blocking the hairs from coming back in, but I can't even see how it's going back there. I might need to buy another mirror just so I can look at it. But yeah, I think I'm pretty happy at this juncture. I feel like maybe the back looks kind of thin, but I know that, there is an ugly duckling phase where everything kind of falls out and then it's going to regrow back. So I'm hoping that, after 6 to 12 months, it's going to look really full, and ideally you can't even tell. But yeah, I did have them leave hair on the top when they gave me the haircut before the procedure. So it looks like I'm kind of like almost back to normal right now, which is kind of cool. I do have kind of a weird line here. I might need to go have that trimmed at a barber shop or something, but to make the fade look better. But yeah, I'm pretty happy that I pretty much look normal at this point. Like my surgical area, let's see if I can show you here. I don't know if you can see. Surgical area is like pretty much back to normal. Sometimes I kind of go here and kind of pick at it a little bit, but at this point, it almost feels like nothing happened. So 3.5 weeks later, I feel like almost nothing happened, and that's pretty awesome. Considering, 2,900 follicles were transplanted on my scalp. I think that's pretty good. So yeah, overall, pretty happy. I feel like it's gonna grow in nicely here and here especially. I would say the back up here looks like it's a little thin, but I know it's probably just a phase. I'm not sure how it looks to other people. I might need to get someone else to take a video of me from the back, but I'm pretty confident that the surgery was done properly and that I'm gonna have a good result here. I know ever since the surgery, I've been taking the oral minoxidil. So Dr. Nader did give me prescriptions. I was able to get them filled at a Walmart in McAllen, Texas. There's a specific Walmart that accepts Mexican prescriptions, so I was able to go in there and get everything taken care of. The oral minoxidil and oral finasteride, that was about 30 or 40 bucks for everything. So I'm taking the oral finasteride pill. I think it's a 1 milligram pill. I'm cutting it in half and taking a 0.5 milligram per day. I don't want to kind of overdo it because I am planning to take these pills for the long term. So I don't want to kind of overdo it. I'd rather take the absolute bare minimum just so I'm getting the max result with the minimal impact onto my body. And the oral minoxidil, I think the pills are 10 milligrams or something, and I basically cut it in 4. So I'm taking 2.5 per day, I think, of that. So it's pretty much the minimum dose that the doctor recommended. I think he recommended 2.5 to 5, and I'm just doing the 2.5. So yeah, that's pretty much it. I think that pretty happy at this point, and I'll make another video in a month or two updating everyone on how it goes. But yeah, I think a once a month video might be a good idea for everyone. But yeah, I'm pretty happy so far. As you can see, it looks pretty decent. I can go around without having a weird hat on or anything, and it doesn't look like I have a completely shaved head. So yeah, if you have questions, go ahead and put it in the comments below. You can find me on Instagram, travel_veteran, if you want to send me a message and ask me any specific questions. But yeah, happy to answer anyone that comments below. All right, thanks guys.